Well, good morning. I am here today as a result of Brian Mills, so I want to thank him. I know he's at our community. We have a big, huge, all-community event over these couple days. I am here to share a personal story as well as a call to action for everybody in regards to the state of our health here in Indiana. And I'm bringing a message of love and hope and grace and also a goal. A message of love for smokers and their families and their friends and anybody that's ever been touched by the ravages of tobacco. Anyone here? Has anyone here been touched by tobacco or any of its diseases? Yeah, I assume many, many people here. Love for the smoker and love for their families, and also grace. We need compassion for smokers. We need understanding that it's easy just to say, quit. It's dirty, it's terrible, costs a lot of money. Look at all the trouble that it's causing in our state and nationally. But it's hard. It's hard to quit smoking. The tobacco companies make it very, very hard. So we have to not pass judgment. We have to be understanding, and we have to help. And a message of hope, because people can quit. As a family physician, and I love that we have a family physician over here, IU, people can quit. I see it every single day. I see smokers quit even after 30, 40, 50 years. There is hope. We can make positive change, and all of us together can make a huge change for the state of Indiana. I have a goal. I have a huge goal, and that's to decrease smoking rates in the state of Indiana. That's number one. And two, to decrease healthcare costs, which we can do. And three, to save lives. And that's, I think, the most important things, because money is important, and smoking rates, decreasing them are important. But individually, it's lives that are the most important thing. And so that's where my personal story comes in. And it starts with two smokers, and that was my mom and my dad. And they started smoking back in the 60s when smoking was cool. And I have this poster in my basement, which is kind of fun. More doctors smoke Camels than any other cigarette. I can't believe we used to advertise that. And one of those smokers quit, and that was my mom. And the other smoker didn't quit, and that was my dad, Butch. We're all from New Jersey, so I'm kind of loud. I might not need this microphone. All grew up a blue-collar family. My dad was the very first one to graduate from college. He put himself through night school. He worked in the pipe and steel industry. We moved around a little bit as a youth, and then back when I was in middle school, we all moved to Northwest Indiana. We originally moved to Chicago, and then we moved right over the state line, 3 blocks from the Cook County state line up in the region, Hammond, then Munster. One of the things that was most shocking to me when we moved there was, and I used to say to my parents, gosh, there's so many tobacco shops just on our side of the state line. Names like State Line Tobacco and Cigs for Less and Low Cost Smokes. And what I didn't realize then was how much cheaper cigarettes were on our side of the tracks. And the other funny thing was that all the liquor stores were on the other side of the state line. You couldn't buy liquor on Sundays. We seem to have a legislature that could fix that liquor problem, not our tobacco problem yet. So we moved here to the region, and me and my brother, and I had a feeling back then that medicine was for me. I had quite a few family members that suffered from significant illnesses, and I said all along, I really want that old-fashioned, I want to help people. My dad and I were very close. He always believed in me. He used to tell people, even when I was young, my daughter's going to be a doctor. I worked at Burger King for 7 years saving money to go to school. I went to IU down in Bloomington. And my dad used, back then when you didn't have a phone, he'd call me in the dorm, 7 o'clock, Friday morning, make sure I was there, not out partying somewhere. He was the cheapest person you ever met. When he found out that Jewel Osco took expired coupons, he went out in the trash to rescue a 35-cent coupon for a loaf of bread and blow-dried it with a blow dryer. So it always floored me that he would pay full price for a pack of Marlboro Red cigarettes and not the cheap, off-brands. He played the lottery faithfully every week, $5 on the Hoosier Lottery and the Powerball. So One morning as I was at Burger King in my my last year of college, I had just gotten in the week before early admission to IU, School of Medicine. I see my mom walking up to Burger King, which she never came to Burger King. She hated that food. And she said, "Your father, he hit the Powerball. He didn't hit all the numbers, but he won $100,000. So she never complained about the lottery after that. But he gave me all that money to go to medical school. So I didn't have to take out any loans for medical school, and I was never allowed to, though, leave my job, because they told me I'd have to pay it back. So there's all of us. That's my family. So after IU School of Medicine, I spent my first 2 years up close to home in Gary, and then back here in Indianapolis. So my career kind of took me all over. I did my residency in Chicago, and then a women's health fellowship, and then I was always committed to working for the underserved. So I've always been in a federally qualified health center and a residency training program. But my dad was always around since we were always close by. He was Mr. Fix-It, kind of fixing this and that and everything, all along, always smoking. Hiding it from the kids. Friends used to tell me, "Oh, I saw your dad driving, and he had a cigarette out the window." Yeah, I know he's still smoking. One day we came home from shopping, and he was out in my backyard smoking. My son, "Is that Pop-Pop smoking?" Whoosh, he put it right in his hand. Burned his hand, didn't want the kids to see him smoking. He just couldn't quit. Had a heart attack when he was 50. Told those docs, "Oh no, I don't smoke anymore." I said, "You know, they can tell. We can tell. We can smell it." May of 2013, I'd moved into a new house in Carmel, had all new rooms, needed to be painted. He was there painting. His ribs were bothering him. He just figured he'd been fixing the car, must have been bruised from replacing the transmission in his old car. I'll never forget where I was at work at St. Vincent when he called and said he'd had it biopsied, and it was undifferentiated carcinoma. The daughter in me knew that it was cancer, and that was bad, but the doctor in me knew that undifferentiated carcinoma in your rib was metastatic, stage 4 something. After that, a bunch of genetic testing later, we found out that it was stage 4 lung cancer, non-small cell. Chemo, radiation, more chemo, side effects. 3 rounds of chemo, fail, kept growing. Another round, a different chemo, fail. Opdivo, you could live longer with Opdivo, fail. By the winter of 2015, he could no longer walk, his kidneys were failing, and he was bedbound. And he weighed about 100 pounds. But he was still with us, and I said, "You know, it's time to stop. The treatment is killing you." So when we talk about cancer and we talk about smoking, we should also talk about cost, more than just to the person, but every PET scan, CT scan, blood draw, biopsy, genetic test, oncology visit, radiology visit, ER visit from when you're so dehydrated from the treatment that's not working, PCP visit, which kind of was me since he didn't really have a PCP. The average cost per year for somebody with stage 3 or 4 cancer is $256,000 a year. And I saw the bills. Opdivo and Keytruda, $13,000 per month. That's per month. Medicare must pay for 6 protected classes of medications. Anti-neoplastics are one of them. But when I try to get Chantix covered for a smoker, I have to spend 30 minutes for a PA. Medicaid will only pay for 1 round a year, and it takes the average American 6 times to quit smoking. Those drugs are pennies in comparison. Smoking-related illnesses comprise 10% of the entire Medicare budget nationally, 15% of the Medicaid budget, and 30% of the budget of the Veterans Administration for health care. What is the cost of death? Cigarette smoking accounts for 9% of all of our health care spending. So when we talk about how can we reduce the cost of health care, we can reduce how many people smoke. But we have to do it with grace and not judgment. In the U.S., it costs $170 billion a year. And we've already heard how much it costs Indiana. $3 billion just in healthcare costs alone, and that doesn't include the $4 billion in lost productivity. Indiana Medicaid alone, $600 million that we could be spending on other things. Just in your own individual households, you pay about $1,000 a year in taxes just to account for smoking. In the U.S., there's 500,000 deaths a year. 21% of the adults in Indiana smoke. That's so many. We're the 41st worst state. In Indiana, 12% of our youth smoke. 24% of our high school students have vaped in the last month. Many of them will go on to smoke. So when we talk about how we can reduce smokers, a teen that doesn't smoke is an adult that does not smoke. In Indiana, we got $579 million from the tobacco settlement funds in 2017. Only $5.9 million were used for tobacco prevention. That's it. We could do so much more. Smoking is responsible for 87% of all lung cancer deaths and 30% of all other cancer deaths. No other product out there is like that. So that $6 or $7 pack of smokes here in Indiana, it costs us $16 in healthcare costs. We have to raise the price. Nothing else scares big tobacco. You can see as the price of those smokes go up, the smoking rates go down. There is nothing else that drops rates more. Smoking kills. It's not glamorous. It's not pretty. Smoking is not anyone's friend. It's kind of like that bad friend that always gets you in trouble, that never invites you to the good parties. It's not. Big tobacco wants your money, and it wants your life. There are 36.5 million smokers in the United States, and they can quit. What can we do? We can do many things. We can band together, and we can talk to our legislators. See these little postcards? They're in your packets. You can go to indiana.gov/legislators and find the legislator in your area. Send them this postcard. Say, we need to raise the cigarette tax. We should also raise the smoking age to 21. I'm in full belief of that. And don't listen to some argument that says we can send our kids to war, we should let them smoke. Terrible argument, because they're banning smoking at military bases. You can also call your legislators. They're sick of hearing from me. But they got voicemails, and they also have assistants that will take your calls as well. And they can hear from you once or 10 times. You can join the board of directors, the IAFP, like I did, so you can go down to the State House, and you can meet everybody, and you can kind of be a thorn in their side, so that 2019 can be our year, and we will raise those taxes. The city of Chicago, their cigarette prices are now about $13. New York City is about the same. They have the lowest smoking rates in their adults in their history at about 8%. It works. It really works. We can offer treatment and actually cover that treatment. I shouldn't have to sit and spend 30 minutes of my time, and I'll do it, for a PA for medication that works. We can offer grace and care and compassion. We really can. We can give the advice to our smoking friends. Try 1-800-QUIT-NOW. We can be a listening ear. So what happens next in the story? So my dad, in December of 2015, went into hospice care. His nurse, Mary, I still talk to her on a regular basis. He couldn't walk, he couldn't get about, but he went into hospice. And about a month later, he said, you know, I want to go to Atlantic City one more time. Nurse Mary called me up. Your father's crazy. He's telling me he's going to Atlantic City. I said, well, I bought him and my husband a ticket on Spirit Airlines. It was really cheap, but I'm kind of using it as a carrot. Maybe he'll feel better. In April of 2016, he and my husband flew to Atlantic City. He was feeling that much better for one last casino trip, where he was able to gamble, walk around. He felt really good. In July of 2016, we went on our 35th yearly trip to New Jersey with the entire family. It was his favorite place to be in the world, and he was able to lay on the beach one last time. And then on August 23rd, we lost him. So losing a loved one to cancer, lung cancer from smoking, is terrible. But we can quit. We can raise it for Indiana. We can raise those cigarette taxes. And we can save lives here in Indiana. Thank you.